Treating symptoms doesn't work. It might buy you time, but it's not going to make you better, and it's not going to make you have a long and healthy future if you've got a chronic health condition. Hi, my name's Simone Buehner, and I practice functional medicine. Functional medicine is about getting to the root cause of your health problems, not treating the symptoms. The symptoms, for me, are a way of understanding what's going wrong behind the scenes. And so the idea of suppressing your symptoms when you don't know what's going wrong in the body is a little bit like taking the batteries out of a smoke detector. You really don't want to do that. Okay, the symptoms are there as a warning. They're telling you that something else has gone wrong. So with functional medicine, we look at the systems behind the body, and then we categorize all your symptoms into different body systems and say which one is most out of balance. Maybe it's your immune system, maybe it's your digestive system, maybe it's your reproductive system, maybe your stress levels are high. But the thing is, all of these systems have an impact on others, particularly high stress levels have an impact on your digestion, on your reproduction, on your sleep. Your sleep has an impact on everything. So where do we begin? Well, at Barefoot Medicine, I begin with taking a daring approach to healthcare. And daring stands for discover, analyse, report, integrate, nourish, and then guide you towards a sustained recovery. So let's break that down. Discovery is about a long and joint process where we try and get to the root cause of what's happened. And that means there's an awful lot of questions. It's a little bit like getting into forensics. You know, I want to know about your birth, your nutrition in childhood, your upbringing, your vaccinations, your illnesses, your emotional well-being, right from childhood through to where you are today, because all of that shapes who you are. It shapes your hormonal responses. It has an impact on the triggers and what triggers health problems. Because unlike Western medicine that just has a cardiologist for looking at your heart, or a rheumatologist, or all the other ologists that just look at different parts of your body, what I do is look at your mental, physical, emotional and spiritual well-being over the years to see what's brought you to this point. Okay, so the D in the daring approach for healthcare is a really in-depth discovery process about who you are and what has brought you to this point today. These long-term chronic health problems have been building up over time. So if you go to your GP with a chronic health problem and they have 7 minutes for you to just sum all of your life up and give them a picture, that's not going to work, okay? And they can't work with their hands tied behind their backs without all the information. And yet the way the health system is structured currently doesn't give your GP the time for that. And just as an aside, having worked with GPs as well as with dissatisfied patients who've lost hope in conventional medicine, I can assure you that the frustration is rife on both sides. GPs know that antidepressants aren't a cure-all for everything. They want to be able to help you, but the system isn't structured like that. And then that takes us to the A of daring, which is analyse. Analyse means test, don't guess. And so I use stool samples, urine samples, maybe breath samples. I can send you a blood testing kit, but actually I don't tend to, because I want to know what's going on in your gut. So analyse means let's find out what's happening behind the scenes in your body. Let's do a 3-day stool sample so we can see what your body's eliminating, because that really gives us a lot of information. In chronic health problems, the main issues I want to know are, number one, are you getting the right nutrients for your body to be able to heal itself? Number two, can those nutrients get to where they are needed and be used effectively? Because if you give your body the ideal chance for healing, it wants to heal itself. You know, your body is built to heal, it's built to maintain homeostasis. So we have to give it a fighting chance. So that's what the A for analyze is. Let's analyze what's going for you so we can give you personalized medicine, personalized solutions that are tailored for you. So that's the D and the A. Next we have the R. And the R is a report, a very, very detailed report about the test results, what it means, and what you can do about it. And all the solutions given to you tend to be natural solutions. So it could be modifiable lifestyle factors, it could be supplements, it could be a particular diet tailored to your needs. So for example, I have online meal plans for people with PCOS. So there's the PCOS meal plan, the pre-diabetes meal plan, the metabolic meal plan, the mitochondrial function meal plan if you've got chronic fatigue. So that is recipes and meals that are tailored towards healing specific conditions. You know, we all know that Hippocrates said, "Let thy food be thy medicine." The bit he didn't say was that your food can also be the slowest form of poison. And so that's one of the things we look at very, very closely in functional medicine. What are you eating? Are you getting the right nutrients? So this report will help you to understand what you need to be eating or what you need to be eliminating. Then we get to the I in the D.A.R.I.N.G approach to healthcare. I is about integrating a new lifestyle plan or a new diet into your existing lifestyle. So this is really important because this is where a lot of people slip up in their recovery, because we are so used to having the same kind of meals, we're around the same people, and it's very difficult to make changes when all the triggers around you are the same. So that's where the longer term plans come in, and that's why I work with people for either 3 months or 6 months, and we have fortnightly check-ins together to see what can be integrated into your lifestyle at a manageable rate, because it's not going to happen overnight and it's not easy. So I would be here to coach you and to help you to gradually integrate those changes into your lifestyle in a manageable, enjoyable and sustainable way. Then we get to the N for in D.A.R.I.N.G. N is about nourishing your body, nourishing your mind. So you have a meal plan that's tailored towards your needs, and you may have supplements that are recommended following your test results, and those recommendations will come from the lab. And we also want to nourish your mind, because what we think is what we become. Every hormonal secretion, everything our body secretes begins with a thought. You know, when you smell food, your mouth waters and all your digestive hormones kick in. When you are going to see a scary film, you can just hear a knock at the door and it makes you leap out of your skin because your body's primed for that. And so what we want to do is prime your body for recovery. And that might mean nourishing your brain, nourishing your mind. You know, what's the chatter that's going on inside? We may need to use mindfulness or meditation or MBSR, that's mindfulness-based stress relief, because stress hormones have a whole load of things to answer for, okay? And so that's N for nourish. And then finally G is the guide to sustained recovery, because I like to think of myself as being your partner from discovery to recovery, and that's our D.A.R.I.N.G approach to healthcare. So the guide to sustained recovery is about having a bright future. You may not have had a great few years as your chronic health condition has built up, but that doesn't mean that it has to be like that going forward. And so understanding what the symptoms mean and what your body is trying to tell you can help you to respond to that in a way that helps your body to help itself. And that will lead you towards a much brighter, healthier, happier, more vital and energetic future. And I would like to be your partner from discovery to recovery. Click the link below if you'd like to have a free 15-minute chat with me and tell me more about what's going on for you, and I'll tell you how functional medicine might be of benefit to you.